Welcome. Thank you for taking the time to learn about living liver donation at U Chicago Medicine. Being a liver donor is an important decision. Donating a part of your liver to someone in need can make a very positive change in that person's life, and the information here can help you make an informed decision. It is important that you understand all of the information regarding living liver donor transplant, including the extensive evaluation process and the risks involved with donation. We want to make sure that you know what to expect, both short-term and long-term, so that you can make the best decision for you. The liver is the largest organ in the body and is about the size of a football. There are two main lobes or sections. The right lobe is larger than the left lobe. The liver is located in the abdomen under the rib cage. The liver works in many ways to keep you healthy. It helps you make clotting factors to prevent bleeding. It cleans out bad chemicals and waste from the blood, such as medicine and alcohol. The liver also helps to make muscle out of protein, aids in digestion, and keeps important nutrients needed in your body. If the liver is damaged or not working properly due to disease, a person may be in need of a liver transplant. The liver is a strong organ and oftentimes can heal itself if it is damaged. A healthy liver can grow back if part of it is removed. This is called regeneration, and the liver is the only organ that can regenerate itself. Because of this, if deemed appropriate, living donors are able to donate a portion of their liver to someone in need. There are two types of liver donors. Deceased donors come from a person who recently died and had a healthy liver. Living donors donate a part of their liver. The remaining liver and transplant liver will grow to the size the body needs. Living donors can be someone that the recipient knows, such as a friend or a family member. There are also donors known as non-directed donors who would like to donate to anyone in need of a transplant and sometimes choose to remain anonymous. The donor team is a multidisciplinary team that is here to support you. Every potential living donor will meet with the team, which includes a liver doctor, a liver surgeon, the donor advocate, social worker, pharmacist, dietitian, and nurse coordinator. Our team is a group of healthcare professionals who have special training and experience in transplantation, and we are here to help you with your decision and provide the best possible care for you before, during, and after your surgery. If you decide to be a donor, we will be with you every step of the way. You are assigned a nurse coordinator as you go through the living donor process. The coordinator's role is to provide education regarding the evaluation process and coordinates the testing and consults needed to be approved as a donor. The nurse coordinator is a liaison between you and the team and is always available to answer any questions or concerns that you may have. She will give you your test results and let you know if any follow-up is needed. She is an advocate for you throughout the process to ensure that you feel comfortable moving forward and understand every part of living donation. In order to make sure that we are protecting the health and safety of the living donor, we complete an extensive evaluation to assess the donor's health. There are certain criteria that may rule out a person as a donor, either for their safety or for prevention of transferring infection or disease to the recipient. If you are considering donation, please call your coordinator to discuss your specific situation so that we can assess whether or not it is safe for you to move forward. In both deceased and living donor transplants, a successful transplant prevents complications associated with liver failure and gives the recipient a new chance at life with a healthy liver. The waiting time for a living donor liver transplant is shorter than waiting for a deceased donor transplant. Recipients have very good outcomes with living donation, often because they are stronger before transplant and are able to complete the transplant prior to life-threatening symptoms occurring while waiting for a deceased donor transplant. The surgery is scheduled ahead of time, and it shortens the wait list for those patients who are not fortunate enough to have a living donor. Although the recipient has a living donor, we do not remove them from the deceased donor wait list until the transplant is complete. While there is no medical benefit to the donor, living donation allows a family member or friend to greatly improve the life of their loved one. Many donors report a significant psychological benefit by having the ability to help someone in need. The number of people who need a transplant continues to grow, and living donation is the best way to save more lives. We will complete an evaluation and testing to make sure that you fall within the criteria that is safe for donation. The donor evaluation begins when you are identified as a possible donor and continues throughout the surgery. Sometimes the testing shows the need for other tests. If a health condition is found that makes the health risk too high, the testing is stopped and you will be told about the condition. If approved for donation, we will coordinate surgery dates with you and the recipient's team. We will continue to follow you for 2 years after donation to monitor for any issues and to make sure that you are well. You can begin your evaluation once your intended recipient is placed on the transplant list. As a possible donor, you will have a very detailed evaluation to make sure there are no medical, psychological, or social problems that would prevent you from being a donor. The liver donor's medical expenses, both for evaluation and surgery, are covered by the recipient's insurance. Our financial coordinator will confirm this coverage prior to your initiation of evaluation. Donors will meet with the social worker to learn what costs to expect, as well as share information about ways to help with expenses that are not covered by the recipient's insurance. There is a possibility that living donors can have difficulty obtaining life insurance after donation, and there may be some financial burden related to costs associated with donation. Please do not hesitate to speak with your social worker to assist in this area. We are required to inform you that the sale or purchase of human organs is a federal crime. We will complete multiple medical tests to ensure your safety in regards to donation. This includes blood work to confirm that your blood type matches the recipient's blood type, and tests to confirm good liver and kidney function, overall health, and immunity to or lack of infectious diseases. We will also test to make sure you do not have or are at risk for any liver disease yourself. We will complete an X-ray to check the health of your lungs and heart testing to check the health of your heart and its ability to undergo the stress of surgery and donation. We complete imaging, including an MRI and CT scan, to look at the anatomy, size, blood supply, and bile ducts of your liver. In some cases, a liver biopsy is warranted. Your doctor will discuss this with you if necessary. Based on your results, additional testing may be required. All donors are required to complete age-appropriate cancer screenings prior to donation. This is to ensure that you yourself are not at risk for cancer and that no cancer can be transferred via the liver to the recipient. You should complete your cancer screening through your primary care physician and send the results to us. These tests must be current at the time of your surgery. Once you have completed all necessary testing and consultations, your case will be discussed at a multidisciplinary team meeting. Here, all team members, including transplant doctors, surgeons, nurses, social workers, dietitians, and pharmacists, sit together and review your evaluation results. The team will make one of several decisions: approved for donation, further evaluation is needed, or not a candidate for donation. Your nurse coordinator will contact you with the team's decision. If you are not a candidate, your nurse coordinator will explain the reasoning behind the transplant team's decision. If further evaluation is needed, we will move forward with making arrangements to complete testing or consults that are needed. If you are approved, we will confirm the intended recipient's readiness for transplant and move forward with making plans for surgery. The donation timeline is based on your completion of necessary testing and how you wish to move forward. Not everyone who considers donation can or will donate. Our Living Donor Advocate team represents you to make sure that whatever you decide remains private. As part of the process, we make sure that you do not feel pressured, coerced, or obligated to donate. This is a decision you need to make for yourself, and you have the right to change your mind at any time. Your reasons for doing so will remain confidential. Your team is completely separate from the recipient's team, and we are here to support you no matter what. None of your information will be shared with anyone outside of the transplant team, including your recipient, without specific written permission from you. You can feel free to share as much or as little as you would like with the recipient and your loved ones. If during your evaluation, the discovery of reportable conditions are found, this information may need to be reported to appropriate health authorities. There are also items that UNOS, the governing body for transplant, requires to be reported for data purposes. About 1 to 2 weeks before your surgery, we will arrange for preoperative appointments. You will have some blood testing completed to confirm that there are no new issues or infections prior to surgery. You will meet with an anesthesiologist to make sure that it is safe for you to undergo anesthesia, and you will meet with your nurse coordinator and surgeon again to review the plan for the day of surgery, sign the surgical consent, and have any questions or concerns addressed. The living donation surgery is called a partial hepatectomy, which means removal of a portion of your liver. Depending on the circumstances of both you and your recipient, they may remove either the left or the right lobe of your liver. In most cases, they will also remove the gallbladder. A drain is placed to help with recovery and is usually removed before you go home. You will be in the surgery for about 6 to 8 hours. If during the surgery the team believes that your health is at risk or the liver is not right for transplant, the surgery will be stopped. With all surgeries, there are risks and possible complications. This is not a surgery that you need, so it is especially important that you understand the risks involved moving forward. Please be sure to review the risks carefully with your transplant team and make sure that you understand them prior to surgery. The risk of any complication from this surgery is about a 15 to 30% chance. The most common complication is a bile leak, which is a small hole in the bile duct system causing bile to spill into the abdomen. Most of the time, this will resolve on its own, but you may require a temporary drain or a procedure to repair it. After your surgery is complete, you will be transferred to the recovery room while you wake up from the anesthesia. You will then be in the intensive care unit so that the team can closely monitor your status after the surgery. Once you are stable and doing well, you will then go to a private room on the transplant floor until you are discharged home. Most donors are in the hospital for about 5 to 7 days after surgery. If you live out of state, the transplant team requires that you stay in the area for at least 2 weeks after transplant. The transplant team will educate you and your support system on all of the things that you need to do to have a successful and speedy recovery. The donor surgery is a major surgery. Everyone recovers at a different pace, but you should plan for about 6 to 8 weeks for a full recovery. You may be released to work earlier if the team feels you are ready and your job does not require strenuous activity or lifting. To prevent complications of wound healing, you should not lift more than 10 pounds for 6 weeks following your surgery. You should not drive for about 3 to 4 weeks because your reaction time behind the wheel will be affected by surgical pain and pain medications that you may be taking. These are 2 important reasons to have a strong support plan in place before surgery. There are no dietary restrictions after donation, but alcohol should be avoided for 6 months after donation. You can be active after donation, but we encourage you to listen to your body and rest when you are feeling sore or tired. Most demanding and strenuous activity can be resumed about 3 months after surgery. For your safety, the transplant team requires follow-up after you donate. About 1 to 2 weeks after donation, you will meet with your surgeon to make sure that you are healing and feeling well after surgery. At 1, 3, 6 months, and 1 and 2 years after donation, we will check your blood to make sure that you are healthy and your liver is working well. At some intervals, we will also do a CT scan to make sure that your liver has regrown and looks healthy. After 2 years, we strongly recommend that you follow up with your primary care doctor yearly and as needed in between. The Transplant team is here to assist you in any way that is needed. Please do not hesitate to contact us with any questions or concerns. We look forward to speaking with you and helping you on this journey. Thank you for taking the time to learn about living donation and for choosing UChicago Medicine for your care.